Hello, my name is Demetria Trejo, Communications Manager with the Division of Health Affairs at UT-RGV. And today we are speaking with UT Health RGV Chief Medical Officer Dr. Michael Dobbs to discuss best practices for COVID-19 during the holiday season. Thank you for speaking with us today, Dr. Dobbs.
Thank you. My pleasure to be here.
So the first question that we have is if you could give us an overview of the current COVID-19 situation here in the RGV.
Certainly, the current COVID-19 situation here in the Rio Grande Valley is not good. It's better than it was in the middle of the summer, with fewer hospitalizations, fewer cases, and thank goodness fewer deaths. However, we're starting to see it go up again.
Mhm.
And I think you know that in the great state of Texas, that the whole state passed 1 million cases just very recently, since the pandemic has begun, that is. And so to say that we would be in a safe place right now would not be true. We still are right in the middle of the pandemic, and people right here in the Rio Grande Valley are spreading the disease. They're getting sick, and some of them are dying.
Right, which is unfortunate. So it's good that people are still staying vigilant, correct? Or we should still stay vigilant?
We very much should still stay vigilant. The positive news is you can kind of see light at the end of the tunnel, in that it looks like effective vaccines are not too far away. But for the moment, we have to stay very vigilant. We remain in a very dangerous time.
Thank you, Dr. Dobbs. My next question would be that we have been dealing with the effects of COVID-19 for about 8 months now. Can you speak on COVID-19 fatigue that people may be experiencing and why we should still, as we mentioned, stay vigilant with the health guidelines?
Only 8 months, huh? It seems like it's been 8 years that we've been dealing with COVID. And sometimes I find it's really hard to believe that we're going to get back to normal, and we aren't going to be in the COVID pandemic era anymore. But we are getting on the right track, and we're going to get through this. I think in the next several months, we're going to see great changes and improvements. Nonetheless, COVID fatigue is a real phenomenon.
Right. And so what do you tell people? Because we deal with it in different ways. Me, myself, I think, man, when is this going to end? And we get tired. And I know a lot of people are feeling like this, and they want to do what they want to do, right? But that's not recommended. And so what do you tell people, especially now with the holidays, about how to still, practice those guidelines that we've been discussing over and over again?
I tell them to think about what it's going to be like a few years in the future, when you're talking with your family, your friends, your kids that are more grown, about, wow, you remember that COVID Christmas where we didn't get to travel and we only saw our grandparents on Zoom. And I also tell them, try new things, try new traditions, try to learn new skills and have new experiences. My own family, we've been getting outside and gardening a lot more. Just things that we might not have taken the time to do before. But I think it's helpful to watch some life grow in flower pots. It just reminds you that that this is a world full of life, and that this annoying, dangerous, devastating virus is going to pass, and life will win. Incidentally, it's a grand argument in science over whether viruses are alive or not. But just keep your spirits up. We are going to get back to a normal life in a few months, I think. We'll probably all be a little shell-shocked for a while.
I want to talk about the new CDC guidelines that we have in regards to wearing masks. What information has changed that we've grown to know?
Well, look, it's basically this. The evidence just keeps piling up more and more and more. Wearing masks is very effective in preventing transmission of this disease, and probably very effective in preventing transmission of most respiratory diseases. What was said for a while was, masks probably don't help. I, I think everybody kind of wondered if that was really true or not, but that's what was said early based on what the scientists knew. And then it was said that masks really help if you put a mask on the person who has COVID-19 because it gets caught right here and doesn't go out into the room. And now what is said is, yeah, that helps. Of course that helps, but it also helps a lot even if you're in a room with someone that's putting COVID out through their mouth or nose, that if you put your mask on, it helps you some too. It helps to prevent it from getting in. I mean, come on, it's common sense. And I think we all kind of knew that in our hearts anyway, but the science is just now really proving it. And if I had COVID-19 and you didn't, and we're in a room together and we're both wearing masks, you're probably not going to get it.
So then we could definitely say that wearing masks is important, not just to protect others, but also to protect yourself.
That's right.
Sounds good. The next question that we have is, what health guidelines should we be implementing today and throughout the holiday season? Should we still be washing our hands? Of course, wearing masks. What advice do you have for the public on this?
I would sum it up in this way. Don't become a close contact. Would you like a definition of what a close contact is?
Please.
A close contact is someone who has been around someone who is COVID positive for 15 minutes in a 24-hour period. So it's not hard to be a close contact. If you go to a family gathering and you're sitting there in the room with Uncle George, and then the next day he calls you and says, hey, guess what? I have COVID-19 and didn't know it. And you were sitting there next to him for 15 minutes. You both weren't wearing your masks. You're now a close contact. Maybe you sat next to him for 5 minutes, then you went in the other room and came back and sat with him for 10. You're a close contact. And you could have avoided it. How could you have avoided it? Well, you could have avoided it by not going in the first place because you didn't know what Uncle George had or didn't have. You could have avoided it by not getting too close to him. And you could have avoided it by both of you wearing masks. Mm-hmm. And by staying outside. If you're going to be around someone, the general guidance is being outside in that great big room we call planet Earth actually is a lot better for dispersing virus particles than the stagnant air that we have inside.
In relation to the holiday season, that people will be looking forward to seeing their families in different ways this year, right? Different than what we're used to. Do you have any tips on how to visit loved ones, but still keep you and your family safe? I think this is going to be the big question, especially in the Rio Grande Valley. We're a close-knit community, and it's going to be very difficult to tell, to tell our family members that things are going to be a little bit different this year. So what would you tell the community on how to stay safe?
The way that you asked it, and I may paraphrase here with what you said, but mm-hmm. It was, can I give tips on how to visit your family and stay safe? The answer is actually no. Right. I can't give tips on how to stay safe when you go and visit other people. But what I can tell you is some things to reduce your risk if you do choose to take that very substantial risk of your life in going and spending time around others who may or may not have COVID. And so I can share that. It again boils down to don't be a close contact. Maintain social distancing, which is 6 feet. Stay outside as much as you can while you're gathering with other people. Wear a mask unless you're actually putting something in your mouth. Mm-hmm. It's a little sloppy if you're wearing a mask and then bring a fork up to it. I've done that before. It's a little embarrassing, and people do like to laugh at that. But those are the main things. You're traveling too. If you're talking about traveling to see family, maybe some people are traveling for hours and hours. You're safer in a car than you are in a plane. A car, if you're alone in a car, but you're probably safer on a plane for 45 minutes than you would be on a bus for 5 hours. Just things to keep in mind in that way. When I travel, I love to stop at places and eat, and I like to go in somewhere and actually order something like, Denny's or Cracker Barrel. Well, I don't do that anymore. Instead, I'll take food with me, or I'll drive through a drive-through. Just staying away from being close to other people as much as you can. Of course, I'm close every day to my wife and to my daughters. Here in our house, we know where each of us has been every day, and we take that very small risk by being close to each other without masks on our face, just like we did before the COVID pandemic every day. I don't do that same thing if I were going to visit a friend or if I had a friend over, and I hardly ever do.
Sounds good.
I know that's really hard all that is really hard to hear, but it's just the truth. And I'd ask people to look at it in this way. If we're pretty confident that a vaccine is coming, and it's coming pretty soon, just hang in there. You don't need to necessarily take the risks, because it's that thing we call fatalism, where you just give up and you're like, oh, I'll just go ahead and see what God's will is. You don't have to do it that way, because we're going to have a vaccine soon, and you're going to have the opportunity to be protected soon in a very effective way. Just hang in there. Don't give up. Don't give in. Don't give up.
Great advice. Another question that we have is, do you have any tips to manage stress during this time? Because it's already stressful. The holidays are coming. Things are going to be different. People may not be seeing their families. People may not be traveling across the country as they normally would. What tips do you have for them and for stress?
Of course. I find that I text my friends a lot and my family. My big brother and I have actually learned a lot of things about each other from texting over the last few months that we just didn't know before. It's also good to exercise. That makes you feel better. It reduces the risk of depression, makes you healthier, makes you feel good in general. A lot of people also find comfort in prayer and meditation, and I recommend both of those. Just think about ways every day that you can enjoy life and appreciate what you have, because you really do have a lot. You have your life, you have your health, and you have people that care about you. So just remember those things as you go through your day to reduce stress. But I will also say this, as a physician, if you are feeling symptoms of depression, like you're really not enjoying things that you used to and not enjoying being around other people or doing the activities that you used to, and you're feeling a sense of despair, don't be afraid to reach out and get the help that you need. In most people's lives, there comes a time when they need some help from other people in that way.
Thank you. My last question would be, any takeaway messages for the community during the end of the year? We're 2 months away from a new year. We've been in COVID-19. And we don't see any end in sight. It's going to be hard this holiday season. What are some takeaway messages that you have?
We do see an end in sight. I'll say that to the community, and that is that there is really good likelihood of an effective vaccine that's coming, maybe more than one effective vaccine. So that is good, and enjoy the holidays, but enjoy them safely, and at a distance from other people. Try something different. Maybe instead of having the whole family for a traditional Thanksgiving gathering, maybe set up a table with at one of the chairs. You have a laptop computer, and you're watching your friends and family by Zoom, and you're still talking, you're still eating together, but it's just a little different.
Right. Switching it up and getting creative this year.
Be creative.
All right. Well, thank you so much, Dr. Dobbs, for speaking with us and talking to us about some of the best practices that we can use for this holiday season during COVID-19.
Truly a pleasure. Thank you for letting me do so. Happy holidays.